Assalamualaikum and good day to all. My name is Ahmad Abid bin Zainal Abidin, and now I will be sharing with you guys about applications that has been implemented by government, specifically the Ministry of Science, Technology and Innovation, or in short MOSTI, by using integration of health informatics to control and manage COVID-19 pandemic. First of all, let's have a quick overview of health informatics. What is health informatics? So, health informatics is an implementation of multidisciplinary field which is information science, computer science, and healthcare. It is the use of IT in management, planning, and delivery of healthcare service, which deals with resources, device, and methods to optimize the acquisition, storage, retrieval, and use of the data in health and biomedicine. So, Malaysia government has implemented some applications for smartphones which now most people have possession of by using the integration of health informatics to manage and control COVID-19 pandemic, which allows easy collection and retrieval of data from the user wherever they are. In this case, I will be focusing on the application implemented by MOSTI. There are two applications, MySejahtera and MyTrace. MySejahtera allows users to perform quick health self-assessment and for the Ministry of Health to monitor users' health condition and take immediate actions in providing treatments. Whereas, MyTrace further complements MySejahtera by detecting and tracing the individuals who are in close contact with the COVID-19 positive patients. First, we go on to MySejahtera apps. This information I use is from MySejahtera official website, where you can get the most reliable and official information about the apps. So if you guys want a further reading, you all can go to mysejahtera.malaysia.gov.my. So MySejahtera is an application developed by the government of Malaysia to assist in monitoring COVID-19 outbreak in the country by empowering users to assess their health risk against COVID-19. This application also provides the Ministry of Health with the necessary information to plan for early and effective countermeasures. Okay, so MySejahtera is developed to number one, assist the government in managing and mitigating the COVID-19 outbreak. How? The data and information collected by user through the apps will be directly sent to Ministry of Health, allowing the allowing them to take quick actions and also monitoring of the pandemic status. The apps also help users themselves in monitoring their health throughout the outbreak. The apps have questions and also guide for the users used to self-assess their own condition. It also gives suggestion of the risk the user have based on the travel history and symptoms they possess. Next, these apps assist users in getting treatment if they are infected with COVID-19. It can notify the authority if users are found affected or have close contact with someone affected. And finally, to add on that point, the apps locate nearest hospital and clinics for COVID-19, which have screening and treatment, which makes it easier for users if they are going for treatment and screening. The apps have extra feature or extension within the apps that are called MySejahtera Check-in, where it empowers business, restaurants, shops, agencies, construction sites, companies, schools, hotels, and all types of premises to follow standard operating procedure developed by government in view of COVID-19 outbreak. It uses information from MySejahtera mobile application, where the user is classified based on the risk towards COVID-19, location and vulnerable dependents at home. So it can monitor the movements in and out of a premises. There are a lot of benefits in using the apps, so everyone in Malaysia should download it. The apps have its own QR scanner which allows give information of our own health status. The apps also have regular updates on new information regarding health and COVID-19, and the information is updated and confirmed to be true because the information is from the government itself. Next, moving on to the second apps, which is MyTrace. It's a preventive countermeasure and contact tracing application for COVID-19. It uses low energy Bluetooth and the security is acknowledged by ISO, International Organization for Standardization, and it is also lightweight. It detects phone number and time only, so it's only for contact tracing, means only with who you have been in contact is traced, not where the user goes. So users safe from being followed or tracked. And the apps is approved by the government itself. There is a manual prepared by the developers and you can access it in MOSTI official website for MyTrace. It is prepared by MOSTI, NSC, Ministry of Health, Malaysian Administrative Modernization and Management Planning Unit, Malaysian Institute of Microelectronic Systems, Magic, and also IIUM with Google Malaysia. So here is a flowchart to explain how to start and use MyTrace. First of all, we need to have the application MySejahtera and MyTrace installed in our mobile phones. Then we can open MySejahtera and open MyTrace to MySejahtera. Registration is needed to use the apps. There will be guidelines to register within the apps and after login, then we already allow MyTrace to run in our phones. After login, the homepage will be displayed and we can use all the features in the apps. This storyboard explains how the usage of both applications can help manage and control COVID-19 pandemic. So, if a patient goes to the hospital for COVID-19 screening and it is confirmed that the patient has COVID-19, the doctor will ask if the patient has MyTrace mobile application. The doctor will log in into the system and find the patient's phone number. The doctor will read the version ID of the patient to verify the version ID is correct. And the doctor will give the PIN number to the patient, which patient will verify by clicking on their own apps. And then patients enter the PIN number and submit to verify the version ID. A log number is generated after clicking submit and it will be valid for 21 days. Only the doctor can view the log number that has been generated, and the Bluetooth feature will capture other users' UUID if they get contacted by the patient, and the doctor can view and print all the log numbers that has been captured by the patient. So the log number will be with the doctor and the doctor can give the list of lot number to the authority so that the authority can detect the close contact made by the patient for the action whether to have them to go for screening and further treatment. Before I end my presentation, I want to take this chance to remind everyone to stay healthy and stay safe. follow the government SOP, and practice the new norms to avoid ourselves from infected with COVID-19. Together we can break the chain of the pandemic. Together we can win this fight. Thank you for your time. Assalamualaikum and see you soon.